Hi everyone, welcome back to Dr. Kumar's channel. Myself Dr.N.Siva Jyothi, cardiopulmonary therapist and yoga therapist. Today we will discuss about a very important topic, breathing exercises. At the present COVID situation, everyone should be aware of the breathing exercise so that they can practice at the home. In this video, I am going to show you all the different types of the breathing exercises which you can practice at the home without anyone's assistance. Okay, so why do we do breathing exercise and how many times should we do and what are the different types of breathing exercise and what are the benefits of this breathing exercise I will explain in this video. This breathing exercise helps in increasing the lung capacity as well as increasing the expansion of the lung and relieving the stress and induces the relaxation to the person and decreases the heart rate as well as decrease the blood pressure. Okay. Now when we practice these exercises will help in reducing the stress. Basically there are the four types of the breathing exercises. One is the diaphragmatic breathing, which is also known as the abdominal breathing or a bellow breathing. The second one is the segmental expansion exercises, and the third one is thoracic expansion exercises, and the fourth one is pursued lip breathing. In this video I will demonstrate you how to do all these breathing exercises and when should we do and how many times should we do. I'll be explaining about all those things in this video. First we will see what is the diaphragmatic breathing exercise and how should we do that one. Okay. For this, our upper thorax and the upper shoulder should be relaxed and the movement should happen only on the abdomen. So whatever the air we are taking in, it should be filled in the abdomen. That means when we are taking the air in, the abdomen should rise up, and when we are leaving out the air, then the abdomen should go inside or sink inside. So we'll see how to do that one. Place your one hand at the thorax and the other hand at the abdomen. Now breathe in through the nose, and whenever you are breathing in, your abdomen should rise in. Okay, rise out. Okay, whenever you are leaving the air out, your abdomen should sink inside. Okay, now do it. Breathe in. You can observe that abdomen is rising on taking the air. Relax. Breathe out. Now if you observe, when the breathe out is happening, the abdomen is sink inside. Again, once again. Breathe in. Breathe out. The common mistake that will happen during this breathing is, instead of taking the air into the abdomen, that will be taken into the chest region. That means whenever they are breathing in, the abdomen will be going inside, and whenever they are breathing out, the abdomen will be coming outside. This is a wrong procedure. That should not be happen. Care should be taken whenever you are taking the breathing, that the movement should happen only on the abdomen, not over the chest region. Now we will demonstrate you how the common mistake will be happening. Yeah. Now breathe in. Breathe out. Just observe again. Breathe in. Abdomen has gone inside and there is a movement happening at the thoracic area, that is chest region. Okay, that should not be happening. The second type is segmental breathing exercises. Segment, name itself is indicating that only some part of the lung is only involved. So conditions like COPD, like chronic bronchitis, emphysema, in those conditions total lung will not be involved, only a part of lung will be involved where there won't be an exchange of the gases will not be happening. So in such cases, we should go for an expansion of that particular segment. So whenever we are doing this breathing segmental expansion exercises, the concentration is the most important thing. That means whatever the segment we wanted to expand, the concentration should be diverted onto that particular segment. Okay, there are basically three types of the segmental breathing expansion exercises. One is apical expansion exercise, second one is an lateral costal expansion exercise, third one is the posterior expansion exercises. Now let us see all the three types of expansion exercises. Now we will see first with apical expansion exercises. Apical means upper part. That means we are concentrating here on the upper part of the lung. Okay. Now you can place the hands in different ways. I will explain you all the alternate methods so that whatever is easier for you, you can place in that manner. So first, place both the hands onto this bone and placing the hands towards your shoulder, facing your fingers towards the shoulder. Okay, this is the one position. The other position is alternatively you can place your alternate hand onto the right hand onto the left side, left hand onto the right side. Okay, the other position is if you are having an involvement is there only onto then one particular side, suppose the right side or the left side. So whatever the segment or whatever the lung we wanted to go for the expansion, we will be placing the hand on that particular side. Now just having a problem over the left apical region. Now place the hand on the only one hand on that particular apical area. Okay. Now do the method. Now place your both the hands. Okay. Now take the air in. Breathe out. Now if you observe in this procedure, the movement is happening only over the apical region. The rest of the body will be in a relaxed position. No movement will be happening over the abdomen. Can you do it once again? Yes, breathe in, breathe out, breathe in, breathe out. Now the second one, lateral expansion exercises. Lateral expansion exercise means we are concentrating on the expansion of the lateral part of the chest. That means our hand should be placed over on the lateral aspect. Now place your hands just onto the upper area. Yes. Okay. This is the one method, and the another alternative method is placing both the hands onto both the sides, or the same way as explained in the apical. If only one area is involved, on the one side is involved, you can place over the hand over the lateral aspect of that particular side. Okay. Now just place your both the hands for your practical purpose, demonstration purpose. I am demonstrating onto both the sides. Okay. Now breathe in. Just observe here, when the breathing in, the expansion is happening over this lateral area. Okay. Breathe in, breathe out. Breathe in, breathe out. This is for the upper coastal expansion, and lower coastal expansion also can be done, means placing the hands slightly lower from that region, and expansion should be concentrated over that lateral area, is the lower or the lateral coastal expansion exercise. Yes, breathe in, breathe out. Breathe in. Now the third one in the segmental expansion exercise is posterior expansion exercise. That means expanding this posterior part of the lung. So it's not possible for ourselves to place our hand at the posterior. So we will do this with the help of a towel or a belt or an dupatta or a bed sheet. You can use any of the thing as per your availability. Now I'll just demonstrate how you will be doing with the help of a towel. Towel should be folded in this manner, and now it should be placed over the lower aspect of the chest. Okay, that means which will be going under this armpit area. Now the main concentration should be over this area where we have to go for the expansion. Now just breathe in, breathe out, breathe in. You can observe when the person is taking the air inside, my hand is moving out. That means expansion is happening over this area, and breathe out. Yes. Okay. So the expansion should be concentrated over this area. Now the third one is thoracic expansion exercise. Our lungs is enclosed in a rib cage, and there is a thorax rib cage is an interlinked connections where if there is any restriction of the range over the thoracic area, it will be restricting the lung expansion also. So in this breathing exercise, we will be concentrating on the thoracic mobility for the expansion of the thoracic region. Now let us see how we will be doing this thoracic expansion exercises. Okay. Now first is raise your hands to the front. Okay. Now when we are taking our hands outside, we should breathe in, and when we are coming back to the same position, breathe out. Now just move your hands outside, breathe in, Now come closer, breathe out. Breathe in, breathe out. And the next exercise in this is, come to the neutral. Now they have to raise their hands upwards, breathe in, and when they are coming down, breathe out. Raise your hands, breathe out. Breathe in, breathe out. Okay. Next one. Now the third one in this is, hand should be raised upwards. Breathe in, get your hands down, breathe out. Again breathe in, get your hands down, breathe out. So these movements will help in increasing the mobility of the thorax, as well as where it will be more rooms will be there for the lungs to expand. The fourth type of breathing exercise is pursued lip breathing. The lip should be pursued when you are breathing out. So in this type, the expiration will be for a longer period of time than an inspiration. That means air will be taken in, but when you are breathing out, that should be for an longer time. That is like 1:2 ratio. So when if you are taking the air for the 2 seconds means that means the expiration or the exhalation of the air should be done for 4 seconds. So when you are doing the expiration, the lip should be pursued, and this breathing exercise will help in preventing the collapse of the airways. Let us see how we will do this pursued lip breathing. Now breathe in, and when you are exhaling, you should pursue your lips and exhale it. Exhale it slowly for a longer time than what you are taking the breathing in. Now again breathe in, breathe out. Now you can observe how the lips has been shown. Okay, so that the breathing out will happen through the pursued lips in a slow manner and for a more time than the breathe in. You have seen all the 4 types of the breathing exercise. These breathing exercises are very important, especially in this COVID-19 situation. When the person is affected with the COVID, the lungs will undergo the fibrosis. That means where there will be no exchange of the gases will be happening and no expansion of the lungs will be happening. So all these breathing exercises will help in increasing the expansion as well as increasing the oxygen saturation to the body. So all these exercises can be done in a comfortable position. That means can be done in a lying down position or in a sitting position, and depends upon the comfort of the person whoever is practicing these exercises. These breathing exercises can be practiced 5 to 10 minutes and twice or thrice in a day, and practice this breathing exercise and keep healthy and stay healthy. If you like the video, share it and subscribe it, and for further notifications click the bell icon. Thank you for watching the video.